world leaders, cervical cancer survivors, advocates, partners and civil society came together on the 17th of November last year to mark the third Cervical Cancer Elimination Day of Action. The initiative, which marked the first time the member states adopted a resolution to eliminate a non-communicable disease, has continued to gain momentum, and this year's commemoration promises to be a beacon of hope, progress and renewed commitment from nations around the world, we're told. At the meeting, the WHO Director General, Dr. Tedros Adhanom Ghebreyesus, said that in the last 3 years, there has been a significant progress just in terms of dealing with the disease, but that women in poorer countries and poor and marginalized women in richer countries still suffer disproportionately from cervical cancer. We speak now to cervical cancer survivor and advocate, Zambian national Karen Nakawala, who's also nominated for the Global Citizens Award under Access to Health category as an HPV champion. Karen, a very good evening to you. Thank you so much for joining us, and congratulations on that nomination, by the way.
Thank you so much. Good to be here.
I'm so glad that you and I are having a positive, joyous conversation, because as I heard you talk about your personal experiences at the WHO conference, you spoke about a very difficult journey. If you could just briefly share it with my viewers, please.
Thank you so much. So I think every cancer patient or every survivor, any person who's going through cancer, they'll tell you that it's not the easiest of journeys to walk. I think it does get very lonely most of the time, because you have to stay away from people to avoid getting infections, because your immune system is suppressed, especially due to the treatment. So but I was lucky, though, that I had a very good support system. But not everybody was as lucky as I was, because I think throughout the journey, the women that I met during my treatment, we formed a sisterhood. And so we'd always check up on each other. And some stories were really sad, where some women actually lost their marriages because of a cancer diagnosis. And this is due to the fact that there isn't much awareness out there. Some lost their jobs, some lost their lives. So it wasn't easy, really, to get out of. But I think I'm one of those that got out on the other side, and really just lucky and grateful to be here today.
And you know, you also recounted some horrendous stories that women really suffer during this time when trying to get treatment. So the stigma behind that is still a problem, you mentioned. But throughout your journey, maybe if you can talk about yours, have you seen a major improvement in terms of enhanced strategies around treatment, screening and vaccination?
Yes, there has been tremendous improvement. But I think what is sad, like you mentioned earlier, is that we have 19 out of 20 countries with the highest burden of cervical cancer are in Africa. And Zambia is the third in the world with the highest burden. So there is still a lot to be done, but strides have been taken, especially when it comes to prevention. We have the HPV vaccine, which is our first line of defense. And now we've moved on to the single dose, which makes it a lot easier for us to cover ground, to cover a lot more girls than when it was on the second dose. And at the time, we're vaccinating only 14 and 15-year-olds. But now we are on the multi-age cohort, which is between 9 and 14. So we have made strides in that. We've made strides in screening. I think there's a lot of awareness going on out there, especially from people like myself. I think we have a lot of survivors in Africa that have just decided they're going to speak up, and they're going to make sure that their sisters get screened and prevent them from going through what we went through. Treatment, we're still lagging a bit behind, because not a lot of countries in Africa have treatment. I think we're still struggling in that regard, but I know that strides are being made, efforts are being made to try and improve the treatment, so that we have good treatment outcomes for those that are diagnosed.
So, Karen, it's exposure and education that'll obviously help a lot of us to understand. For instance, why you do screening for somebody at the age of 9. What exactly are we talking about here when we talk about HPV, when we talk about cervical cancer? And how does a 9-year-old actually understand why they have to undergo that?
They probably may not be able to understand, but I think we do underestimate the mind of a child. But however, we try to educate the parents on understanding the need for their children to get the HPV vaccination, because that is what is going to protect them from getting cervical cancer in the future. However, they still have to go for screening, when they're the right age, when they're 25, depending on the guidelines in the country. But the reason why it is given to the girls at a young age is because they haven't yet been exposed sexually. So the drug is going to work more effectively than if it is given to a person like myself who's already been exposed and, my immune system is already suppressed. So I think we just need to make parents aware, guardians aware that this is a life-saving intervention that we have. And if we do it correctly, we are able to eliminate cervical cancer. So like you say, it is just information, awareness, and education so that people can understand the relation between between HPV and cervical cancer and why the children need to get vaccinated at an early age. So that is why we go for kids between the ages of 9 and 14. We believe that they haven't yet had their sexual debut.
Often when we talk about things that appear obscure, you mentioned that in children who are young, for instance, even though they may not be sexually active, but I understand that there are different types of high-risk HPV infections. But, I'm just trying to understand, how do you explain it to somebody? What is HPV infections? What is cervical cancer, which, as you say, can result in that if there's a progression of the others? And unfortunately, in this horrible world that we live in, we believe that children are not sexually active, but there's also a great deal of abuse that occurs.
Absolutely. So the HPV, I think each and every one of us has got the HPV virus in us, and sometimes we get the infection, but because your immune system is strong, it clears without you even knowing that you actually had an HPV infection. But however, if that is left untreated, it now progresses to cancer cells, okay? And so if somebody is not getting screened, it now progresses to invasive cancer, which is cervical cancer. So that is why we're talking about protecting the young children with the HPV vaccine so they don't get to that point of having invasive cancer like I did. So if you get the cancer cells and you are screened and they find them, they're able to treat them there and then, which means that you'll be saved from getting invasive cancer. Okay, but then you still have to go for regular screening. But when it gets to invasive cancer, like it was in my case, unfortunately, it had got to a point where it needed to be treated. So I had to go through chemotherapy, radiation, and also brachytherapy. So there's that progression. But the goodness, if I may call it that, is that it is a very long progressing disease. Okay, it will take 10 to 15 years for it to actually get to invasive cancer. So we still have a lot of time. And that is why if we vaccinate a child today who's 9 years old, by the time she's 25 and she goes for her screening, it's very unlikely that they're going to find cancer cells in her.
Karen,
and I think that is why even the screening guidelines start at 25 years in most countries.
I really appreciate your time and thank you for sharing your journey with us and helping us educate ourselves and our viewers. Karen Nakawala is a cervical cancer survivor and advocate.